My charge a little bit for this part is to kind of hopefully put things in perspective from a diagnostic aspect. As Marlon talked about the clinical part, Heather talked about the microbiome and all the changes that are going on, which is really interesting. But the problem comes down is, okay, what can we do and how do we diagnose this to find a problem? Should we be having diarrhea? So my goal for this presentation is to, pun intended, firm up the diagnostic tests or issues that it relates to swine diarrhea. A lot of this will have to deal with pathogens that we know about, but also some non-pathogenic things as we go through our diagnostic search of what may be going on when we're initially investigating these diagnostic cases. And my first point would be a pathogen is only a pathogen when the conditions allow for pathogenicity to occur. So take that all into respect and say that there's a lot of different things that are occurring in the barn, in the environment, in the gut that are going on that have a huge impact on how we can diagnose things. And I love the diagnostic aspect, but it's very difficult at times. And that's because as a pathologist, I know what's going on. I can read books in a perfect setting. I can diagnose something. I can do that. We add the mix of the real world in there. There's a lot of different changes or antibiotic uses. It gets really difficult. Really difficult. So hopefully we'll kind of combine some of that stuff and take some take-home points for you. The first thing I thought I'd do, though, is step back a little bit and have you understand the GI tract from a clinical perspective, because I think we forget this a lot of the times. And you can really kind of hone in where the disease is if you do a little bit of extra time and actually look at what's going on. So for instance, remember back in vet school, we learned that small intestinal disease was generally normal frequency, but relatively high volume. Now the difference, large intestine, is high frequency, but low volume. The other thing that I'd like to point out is that mucus production, when we think of mucus, we always think of dysentery. I mean, our mind just jumps to that. Well, mucus production is just a response to a disruption in the colon. It's just a mechanism. So just because there's mucus doesn't necessarily mean there's an infectious pathogen there that we have to try to diagnose. But it's just a response that we can get. I'd also like to point out one thing about blood. If it's frank blood, obviously if it's red, it's coming from the colon, or large colon. And if it's digested, if it's completely black, it probably originated the stomach or the upper small intestine. If it's somewhat yellow to brown, it's probably somewhere in the mid-intestine, mid-small intestine. So it maybe help you diagnose things as you go look at these different colored feces here and there in the barns. The other thing I'd like you to understand about the GI tract is we have bacteria, we have viruses, we have protozoa, we have yeast, fungi, you name it, it's all in there. Most of our things break down into viruses and bacteria, though. And real quickly, if you're trying to diagnose those, especially for viruses, you need acute phase of disease, because shedding is sometimes pretty much short. And for bacterial diseases, we really like to have that acute, unaffected pig to make a proper diagnosis. Antibiotics are a big wrinkle in what we try to find when it comes to the diagnostic lab. Another important point that I'd like to point out is that the intestinal mucosa really autolyzes rapidly, and if you don't get samples into us quickly, we have no idea to check if this isolation of this E. coli or this Salmonella has anything to do with what you're seeing in the barn. Just because you isolate something doesn't mean that it's the cause. And that kind of gets us into the next, sorry, did I do things? Nope. All right. So understanding the GI continued is at the normal flora. We heard about it from Heather, but it's huge. It's huge. It's estimated that somewhere between 10 to the 14th bacteria are within the gut. We are only beginning to understand the different relationships that are going on in that pig, and sometimes how that relates to immunity, how that relates to nutrition and feed efficiency, and how that relates to multiple other different things of the metabolics. For instance, there's numerous benefits of this gut microbiota in the colon, at least, because it can continue to break down some feedstuffs, and you can gain additive nutrition. It's very important in some water transport, because that's what your colon is built for, really. The whole job of the colon, or primary job of the colon, is to reabsorb all the water that you're seeing. So that's, I mean, these bacteria are helping do that. And the last thing it does is, if you think about it, it helps in immunity. And there's some papers on this. But what it's doing is it's kind of a competitive inhibition. It's just kind of, the normal populations are there. They're letting the pig's body, their immune system, have a little taste of this bacteria, so that it provides immunity so it doesn't grow and bloom and cause disease later on. So the microbiota is very important in regulating a whole bunch of different things. And, you know, it's going to be, I can't wait to the years to come to see what the research says in there. But we're really only starting to understand it, and it's very complex. When you're trying to firm up these diagnostics and for diarrhea, I think I just have to add a little bit of diagnostic interpretation for you, because it's kind of frustrating on my end. A positive test does not mean cause. I think you know that, but too many times we get an E. coli of the intestine of a small pig, and we associate that that's the cause. Well, how do you know? We could have the stressor, as Marlon was talking about. There's a lot of different things. Also, a negative test doesn't mean it's not there. We could have had antibiotics, or we could have been too early or too late in the disease process to really pick up what we're looking for. So keep that in mind. It may take multiple diagnostics submissions to get there, but when you find them and get them, don't overinterpret. Do not overinterpret, and make sure you're trying to keep your biases to yourself. They're good biases, I know, because of experience, but you have to be fairly objective when you're doing these diarrhea workups. Don't say, oh, this looks like such and such diarrhea as a cause, because then you're excluding a whole bunch of other things, like it could be the water, it could be the feed, it could be a whole lot of different things. It's just saying that, oh, I'm used to this, I know that's E. coli at this point in time. Well, you might be missing a whole lot of other things, and money might be going down your pocket. So I'm going to do two parts here. We're going to do neonatal diarrhea, and we're going to do finishing, or nurse will go finish diarrhea, and there's a little quiz part of this. So everybody be paying attention, because you'll be graded at the end. Anyway, the concepts for neonatal diarrhea. First, you got to remember the newborn pig, it's got a sterile gut. So at birth, it's a complete race for all that microbiota to set up shop. That is probably the biggest key to remember. So overgrowth is really common because all those other bacteria are keeping things in check. And the environment plays a huge role in that. And here's some things that I can just think about. You got the environment itself and the dam. You can do about gestation, the type of gestation, the parity, gilt acclimation, all that stuff, the sanitation, just can play into the amount of bacteria that's in the environment. But then also the dam immunity plays into it, like feedback, how much the sow is milking, how often she's milking, colostral intake. That's all important when it comes down to neonatal diarrhea. For instance, here's just my quick graph to getting things wrapped around your head. If you look at the C. diff, the C. perf, type A and C, and the E. coli, they're all generally within the first week of life. Those are very, very common bacteria and common parts of the microbiota, but it's a race because they rapidly replicate really fast, and that fast replication with no diminish causes disease. So we always see those in the first part of life. Interestingly, the viruses, we're having a big increase in rotavirus, at least in populations. Rotavirus immunity is based on the amount of IgG in milk that's provided. We have a lot of type A immunity from the sows, but the B and C's was what we're getting a little bit questioned about. So that immunity may not be there, and that's why we may be getting some of those B's and C's in those early neonates. One little cool fact about rotavirus is it usually attacks the tips of the villi because that's where the mature enterocytes are. In a neonatal pig, when it's born, all the enterocytes are mature. So it can really attack the whole length of the villus right away, the first few days of life, and that's why you get more severe disease in those first 1 to 3, 4, or 5 days of life. So with that, I want to play a little game. All right, is everybody ready? Okay. Associated cause. What's the associated cause for this picture?
Difficile.
C. difficile. All right, very good. So C. difficile causes mesocolonic edema in pigs. Do you know how many times, what's the incidence of mesocolonic edema in C. diff affected pigs? 50% of the time, C. difficile will actually cause this lesion. So if you, just based on your C. diff diagnosis on mesocolonic edema, you're missing 50% of your pigs. C. difficile is very ubiquitous. It's aerosol spread. It's huge in the human literature. That's how they think that's from hospital to hospital or within hospital patients now is based on aerosol. And it's very important to antibiotic use in humans, but in pigs we found that it's probably not related to antimicrobial therapy. It's more likely related to just that fast, rapid growth of a young pig. All right. 12-day-old pig. Anybody got a cause for me? Coccidiosis. Coccidiosis causes atrophic enteritis, very similar to maybe rota and corona, but the issue is we get a fibrinous exudate on these guys. Coccidiosis generally occurs a couple of the first 2 weeks of life, probably from 7 to 18 days roughly is the most common time point. But the interesting part is they get infected a lot earlier, and in life they can be affected as early as 1 to 2 days, and then you don't see the diarrhea until later on. So this is an issue. When you diagnose this, we need feces are probably not going to do it to do a fecal float because they're probably not shedding yet. So we need to at least look at the histopath. All right. One of them's normal. Which one's not like the other? Left or right?
Right is abnormal.
Right is abnormal. What's wrong with the one on the right?
I'm like going to be the audience.
Well, you're up here. I can talk to you. You burned me. I get to pick on you now.
I didn't burn you. Hey, I'd see thin-walled intestines.
Very good. Thin-walled intestine. What are your differentials?
It could be TGE rota.
Yep.
Would be heavy on that.
Yep. TGE and rota corona are your top two differentials. Now, do you see this all the time? No. It's a nice finding when you do see it. It's just saying that my villus are there, they're no longer there, and I can't. It can help you with the diagnosis, I should say. How about this one? Clostridium perfringens type C, because you have the hemorrhagic mucosa along with some emphysema in there. My point being, on this one again, it's just a rapid replication. We've done a nice job with diagnostics, with actually prevention and vaccine to get rid of this one, so we don't see it a whole lot, but it's still out there. And my last one and favorite one, cause.
Coccidia. No.
Beats the hell out of me, because what I tell you is, you cannot tell anything based on what a diarrhea looks like in a suckling pig. Because they're all on the same diet, it's always going to be yellow to white. And if you look at it and say it's this, you may get lucky and be right 50% of the time, but you're going to be wrong the other 50% of the time. So the importance would be you really have to do some diagnostics. They don't cost much, but to get a diagnosis and know where you need to focus. All right, we're going to shift gears a little bit to the post-weaning and finishing diarrhea. And the two most common things we see of post-weaning diarrhea would be rotavirus and E. coli. And the E. coli's are mostly hemolytic after weaning. Those are the most important ones. There's a little table down at the bottom. K88 and F18 are hemolytic isolates. The other isolates are non-hemolytic. So can K88 and can these other isolates, these 987Ps and so forth, be pathogenic and have toxins? You bet they can. We have to actually look for them to determine that. So my point with the E. coli is that I heard Marlon mention something about taking feces, and I cringed a little bit, which he's doing. But E. coli generally causes problems in the small intestine. That's where it's going to attach. That's where usually the toxin is going to be absorbed. You can monitor by feces, but if you really want a for sure diagnosis, you should probably culture the small intestine itself. That's kind of the best. I know Marlon was just doing a surveillance thing, but for E. coli, we really need to culture the small intestines, taking the word for what you're finding out of the colon can be a totally different population. You may find KD8 someplace and F18 in another place, but you really need to find it from where this disease is causing. I mentioned earlier that the rotaviruses were pretty important. And this is what we found in the last year and a half at Iowa State, the differences of where we're diagnosing rotavirus. And I think the big thing that we want to show you is the age breakdown. So group A's, we're finding those right away post-weaning. We're finding very little under 7, well, about a third of them are under 7 days. But lactogenic immunity is really what prevents type A in suckling pigs. So if you're getting a good vaccine or good feedback, you greatly reduce the type A's when they're suckling. Group B's, mostly finding those, it's kind of equal distribution everywhere. But the big thing to note is the type C's, we're finding a heck of a lot more of those in really young pigs because the immunity given to them by the sows or every time they suckle is not there, and that's what we're seeing. Salmonella. This is a big hot topic, I think, because of diagnosis and what it means and so forth. But basically, there's only 2 salmonellas that are really important we look at. Typhimurium, which is serogroup B, and it affects the small and large intestine. Then there's Cholera suis, which is the septicemic pathogen, which is a C1. If you have other isolates, not like a C2 or some other B, be very, very hesitant to call it a disease in that pig causing the diarrhea, because only under certain circumstances will other salmonellas actually cause clinical disease in pigs. Most of the time, when you find some other salmonella, it's just that they're a carrier pig. So the 2 important ones we've got to watch out for are Typhimurium and Cholera suis. The other ones, there's a potential to cause disease, but in general, they have to be really circumstantial. The last thing I'd like to mention about Salmonella is there's a difference of how it's reported. You kind of have to know this at the lab, whether it's the direct culture from intestines or it's actually a tissue enrichment. And that's 2 different things. If you get a direct culture, yeah, it's probably causing the diarrhea. But if you get a tissue enrichment, basically it took all the tissues from the pig and put it in a salmonella broth and we got it out of something. If you get an enrichment, it's a lesser chance that that pig is actually affected by it. It means it's a carrier and disease could happen or may have happened, but at this point in time, it's probably not the cause of the diarrhea, if that makes sense. I'd like to hit on Lawsonia quickly because sometimes people get confused. There's multiple different types. Yes, we're taught about the thickened intestines, but one part that everybody forgets about is the acute hemorrhagic form and sudden death. Sometimes there's not a proliferative aspect to that ileum, and all you'll find is a blood clot within the lumen of the ileum. So kind of important to look at that and spend some time to actually try to find those actual lesions. Another aspect that's really hitting the swine world is Brachyspira and what that means. From a diagnostic perspective, there's about 6 Brachyspira species. And I kind of break them down into weakly hemolytic and strong hemolytic, beta hemolytic. The strong beta hemolytic ones actually cause that mucohemorrhagic diarrhea that we're used to. These weakly beta hemolytic ones typically do not cause the hemorrhage, but may be associated with mucus production and decreased average daily gain. Again, when you see mucus, it just means there's a colonic problem and not necessarily it's associated with Brachyspira itself. So keep that in mind. But what I wanted to really hone in on is that if it's a weakly hemolytic isolate, it could be Pilis coli or possibly Murdochii. Pilis coli we don't diagnose a whole lot here, but in Australia they do. And Murdochii is really only a weak pathogen. Again, if the environment's right or the microbiota is messed up, we may have a little issue with that. So the best thing to do is culture those. The strongly hemolytic ones are Dysenteriae, and people are going to start talking about Brachyspira hampsonii. It's a strongly hemolytic isolate that differs from Dysenteriae. Connie Gephardt was in here. I think she went to talk, but that's what it's just been named. We were finding it and calling it a strongly hemolytic intermedia. But those two pathogens, well, and there was the Canadian strains as well, but those two pathogens now are the ones that can look exactly the same and be associated with dysentery. We're going to talk about the non-infectious diarrhea real quick and get towards and wrap it up here. There's a lot of heartache probably about nonspecific colitis and getting that diagnosis from the lab. And this is my 2 cents on it. Generally call it dysbacteriosis or nonspecific colitis, interchangeable by the pathologist. When you look at it though, you can tell that something's wrong in the colon. Something's just not right. There might be a little bit more inflammation. There might be a little more mucus production. There might be more spirochetes in glands. There might be more dilatated glands. But there's nothing specific that correlates it to a Salmonella, Dysentery type Brachyspira, or Lawsonia, or anything like that. So you get that diagnosis quite a bit. And that's where this kind of wraps back up with the microbiota is that change, we can see it, but we can't fully understand it and give it a name all the time that you're looking for. Oh, I need to fix this or I need to fix that. It's very difficult for us. But what I try to tell people or what we need to do in those situations is step back a little bit instead of just sending, oh, I have diarrhea, quick, get something to the lab. Step back, let's look at what's changed in the system, what's changed at the site. Have we had a feed change, a different diet, or they're just phasing to the next, or they're just going to the next phase, and maybe we have more zinc, or maybe more nutrients getting to the colon, or do we change from distillers to high bakery products? I don't know, but all those minor changes will affect that microbiota. For example, you can all relate to this. You drink too much. Sometimes the next morning you don't feel good, and you yourself have diarrhea, right? There was a little extra carbohydrates getting to your colon, I'm pretty sure. So, I mean, that's the same thing what's happened to a pig if their diets change in that respect. So sometimes you've got to do gradual things over time, but just keep those interactions in the back of your mind when you're trying to do these little things. Because even, as Marlon alluded to, and we're going to see in the next slide, water quality has an issue. Minerals like the zinc cause looseness because of osmotic pull. Also, mycotoxins are known to cause transient diarrhea in pigs when they start getting fed. Real quickly on the water quality, it's generally considered osmotic diarrhea. What that means is obviously if you have two things of water and you have one side that has high salt and another one that doesn't, put them together, they're going to equilibrate. Well, the colon's job is to pull water in. If there's too much stuff that's keeping it in the lumen, you're going to have an osmotic diarrhea. And that's what you're seeing with water quality issues, as Marlon alluded to. Typically, we look at sulfates and total dissolved solids. Basically, that's just a measurement of hardness. You hear about people talking about hard water. That's all this is. It's just how much nutrients and how much stuff is there that may be pulling or disrupting absorption of different things. In general, we like to keep it pretty low, but higher levels can be associated with transient diarrhea. So anywhere from 5,000 to 7,000 is reasonably safe for pigs. They will have a transient diarrhea generally for the first week to 10 days, but they should overcome it eventually. There's some situations where, yeah, that's not true. They got hard water all the time, and they'll probably have a little bit of looseness. All right, we'll make this quick. Game time, Spencer. Cause?
Hemolytic E. coli.
Hemolytic E. coli, very good. Real quickly on hemolytic E. coli isolation. Should be from the small intestines. Should have a high pure growth. That's what you're looking for. If you just find hemolytic E. coli, it's hard to associate cause of the diarrhea without that high growth. And then you could genotype or determine if the toxins are there. Spencer, I don't know if you can see this. This is slightly red diarrhea and puddling.
I would guess Salmonella.
That's a very good guess. It's the number one differential. Probably in this case, because of the slightly brown color, it's probably a Lawsonia infection, just out of experience. It's kind of that golden yellow to slightly brown means it's late jejunal, early ileum, or ileum kind of bleeding, and that's maybe what the cause is. All right, now Spencer, what's your cause on this one?
Ileitis.
Ileitis plus?
The necrotic intestinal.
Plus your Salmonella.
Okay, Salmonella.
I'm just throwing you different things in because everything's not always one thing that you think about. But febrile necrotic enteritis is typical of Salmonella. Also, it can be seen in Lawsonia. This actually could be a straight Lawsonia case, but it was actually a mixture of both. So sometimes we might be seeing things in combination, making things worse. And that brings up my point that, as we alluded to with Heather, you got different shifts of Salmonella low and high shedders. You're changing the gut microbiota, and now you may have another pathogen that was being kept in check by some bacteria that's now no longer there. You may have Salmonella this or Brachyspira that. So just changes in that microbiota kind of decrease the defenses, and then the niches change and allow different bacteria to grow.
Ileitis.
Colon?
It's a colon.
Anybody got a guess?
Salmonella.
This is what's that mucus right there. So if it's mucus and febrile necrotic in the colon.
Spirochetal coli.
Yeah, very good. Brachyspira. This is Brachyspira hyperdysentery, actually, an infection model. So just trying to point out, if you don't look for things, your diagnosis kind of gets skewed. So euthanizing or actually taking the time to find different segments and open them up is beneficial. And this is a combination of them all. This is a mean one, but you got ileitis and Brachyspira and Salmonella type B all going on at the same time. So my point being is, if you don't do the diagnostics, you'll never know. So my take-home points for today are pretty simple. I try to keep it that way. Neonatal diarrhea is a mostly infectious process, but it's regulated by the fact that that gut is sterile and there's a race for the microbial population to occur. Generally, that's happening in bacterial isolates. So key management factors, as Marlon kind of held on to and talked about, is very important. The amount of colostrum and so forth. In post-weaning, there's a lot of mixture of infectious and non-infectious diarrhea. Diet plays a huge role in that, just the changes of what's going on in the microbiota. So you really need to probably get diagnosis, but try not to overinterpret and really take into effect of what's happening with that pig, those stressors, those antibiotics, you name it that's going on, that water quality that may be playing into it. And finally, the keys to diagnostic success would be have good sample selection, know that it's not always infectious. As we're always taught, it's got to be something, it's got to be something, it's got to be something. It's not always infectious. Pathogen detection doesn't equal cause. And be observant. Try to figure out what's going on. Those are my big terms. As a diagnostic pathologist, I want to find an answer for you. But sometimes we can't do it because there's all that background noise that's going on, and we do the best we can.